So, what would you say in Belize, as far as the healthcare system goes? What do you all do very well?
Um, so we do a lot of stuff that is very well, we try. Um, Starting from the hospital or what
From the hospital standpoint, from you, from just a broad standpoint, however you want to answer. So, like for the hospital example, let's take Orange Walk. What do you think the hospital does very
Well,
well?
we try to provide service for everyone. We don't charge. Okay? It's not like the private institutions. It's a government institution, of course, and it's health, sorry, um, treatment is provided for all, even if you're rich, even if you don't have much money, even if you have no money. Okay?
Okay.
And one thing I really like is that we have abundant medications. Sometimes we don't have though. I'm gonna be sincere with you. But for antiretroviral medications for HIV, we have. Okay, all right. We have a lot of medications that we provide. We give the ones that we don't have. We're gonna tell you sincere that we don't have, and you'll need to buy it privately.
Okay.
Okay. Not only that, we have a good follow-up of the mothers. Okay, whenever they're pregnant, we have a system that is followed by the MCH department. These ladies are in charge of following all pregnant women from from initial um, from initially when you're pregnant, which is la captación, they say in Spanish, to the moment that you deliver or you are being operated for C-section.
Okay.
Okay, right. So we have good specialists in our hospitals. I believe that that's something good. Okay, but we need more specialists. Such as more cardiologists, nephrologists. Because a lot of complicated cases, like for example, complications of diabetes mellitus and high blood pressure, tends to, if not treated well, leads to renal insufficiency. And who follow these people? These guys, who get to follow them? No one. Just the internist. Okay, there's no nephrologist. There's no urologist. Okay, but overall, I think we are managing and doing as much as we could with the little we have.
Yeah. No, you answered my next question. I was gonna say if you think anything could be improved upon in the healthcare system, or I guess Orange Walk Hospital specifically,
Yeah.
what would it be? So it just more
It's
specialists.
more specialists. Another pediatrician. We have one pediatrician.
Oh wow.
Also, other specialists, like I said, urologists, cardiologists, nephrologists. But not only that, if we're gonna get these specialists, they need appropriate equipments, better equipments, okay, or you can get the equipments because we don't have them. Okay, we have the major four, which are the pediatricians, the surgeons, the gynecologists, and the internists in our institution. We have orthopedic surgeon as well. These are the only ones that we have.
Oh wow.
And it's about 12 to 15 medical officers working with them.
Okay.
So, and we do depend a lot on specialists.
Yeah. Wow. I was gonna say, how important do you think these clinics are to the communities?
It's very, very important. I think, like how I mentioned to the young lady previously, that ISL is doing a very, very good work because it benefits both of us. It does benefit you guys, and it does benefit our people, our Belizean people, due to the fact that you guys come and assist our public with medications. Sometimes we don't have abundant medications or medications that we would like to have, and you guys have it, right? Not only that, you guys come to learn a lot from our environment, from our people, from us, okay? And we also tend to learn a lot from you guys. So it's give and take,
Yeah.
So.
Okay. No, that's awesome. I appreciate that.
Yeah.
Do you think people are pretty good about seeking out medical care, or is it something that, like, when we did door-to-door walks, you have to go to them and kind of...
I believe that you guys did a great job in go and seek for them, because if we were going to be here, come without informing the public, what would happen? No one would come. Okay, so I believe you guys did a great job, excellent job. That you guys go from house to house, door to door, knocking on doors, and informing the people that you're gonna be having a clinic here. Okay, and that is more as a motivation for our public as well, because from here to the hospital is a bit far. Okay, and these guys, some of them, or not most of them, some of them don't have transportation. If there's transportation, there might be one bus or two bus coming over the day, and it makes it accessible for them. Okay, medication, treatment, it's very, and it's a motivation for them to come out and get examined and get checked up.
Okay.
Okay.
Awesome.
So,
what does the population of people coming into the hospital look like? Is it more males than females? Is it more older or younger? Is it people who have more severe conditions and are coming too late?
yeah, well, a lot of, you can see in our society that we have a lot of women coming in for checkups, due to the fact that most males are working, and if they're not working, they have a mindset that you're strong, you're a man, I don't need no one to see me, no one to examine me, to touch me. I'm a man, right? That's a lot of that's a mentality that we have in our community. It's called machismo. Okay, and these guys, they believe that they're tough ones, and these are the same guys later on that come in our institution in very, very, very poor conditions. Okay, meanwhile the woman has a good follow-up. They are always there, constantly, and the little symptom, they go and they consult, right? Because they take care of themselves. Okay. On the other hand, the males, they don't, right?
Yeah. No, that's awesome. That's all the questions I had.
Okay.
Thank you for answering that, because I mean, like, yes, this is for a class, but like this is informational for like us.
Yeah,
That's for life.
definitely.
Yeah, and like there's a lot of